Yes. So I'll mention a couple of things that are important from nanotechnology, and then I'll discuss this question with you. So what is important from the nanotechnology part? So we talked about properties of nano. Applications of nano is important. Already we have seen question on carbon nanotubes. We have seen a question. In past, a question came where they focused on asking these features. One, they said nanotechnology has applications in following things. They said this can be used in gene delivery systems, and it can be used in gene therapy process. Only two statements they have given related to applications of nano in the past. One, they're talking about delivering genes, delivering light, delivering different sorts of things. Is it possible through nano? Nano cages can carry drugs, nano cages can carry genes, nano cages can carry light. So they are very important in cancer treatments nowadays, cancer therapies. Okay, and gene therapy, can they be seen as a connection to gene therapy process? Is there any connection between nano drug delivery systems or nano delivery systems and gene therapy? So the question is, what is gene therapy? Have you heard about gene therapy? Is also important because recently Indian government has released guidelines for conducting gene therapy in the country. So in the background of that, understanding gene therapy is important. So what is gene therapy? So gene therapy is a way of treating genetic diseases. What causes genetic diseases? Mutations. Basically, genetic diseases can happen due to most commonly mutations in our instructions in DNA. Especially in the gene regions, genes that code for proteins, if they got mutated, that function will be missing. Like blood clotting doesn't happen in what type of genetic disease? What is a genetic disease where blood clotting doesn't take place? Hemophilia. You heard about hemophilia? Hemophilia, blood doesn't clot. Why? There is a clotting factor which is supposed to be functional undergone mutation. Okay, such clotting factor, if it is absent, it leads to no clotting process, which is a genetic disease, because the origin of the problem is from the DNA, mutation in DNA. So if you have to treat such problems, we need to deliver normal functional version of the genes into patient body. There is no simple solutions to it. Hemophilia, we have a solution. Biotechnology can create that missing clotting factor which can be injected into the body. Very much like how we inject insulin. Similarly, missing clotting factor can be made using GMOs and injected into the body. Okay, but if there are any problems, in last 2 years ago, there was a treatment, children with a rare disorder called SCID, where these children do not have working immune system. So they have immunodeficiency. This ID stands for immunodeficiency. These children don't have working immune system. So can they survive if they don't have working immune system? Even after having a functional immune system, children are struggling with infections. They are very, very much prone to infections. And some children with genetic problem don't have operating immune system. They cannot survive. There is a disease, this is called a bubble baby syndrome. There was a Hollywood movie made on this. Bubble baby syndrome. This particular syndrome, scientists have successfully treated it using gene therapy. For that, what they have to do? They have to replace the defective mutant version of the gene with a normal copy of the gene. So what they have to do? If this is a defective gene, they have to put a normal functional copy of the gene. For that, you need a system to deliver genes, and they are using nanoparticles for delivering genes. They are using nanoparticles for delivering light, cancer treatment, cancer therapies, nanoparticles for delivering drugs. We have heard so many such examples in recent times. Hyderabad Central University have created temperature regulated drug delivery systems, because we have a dedicated mission in India related to nano. Okay, so many applications are coming, many products are coming out of this. Sometimes Hindu newspaper has all applications from nanotechnology in some Sunday articles. So be aware about it. So many examples I cannot cover in the class, but I am giving holistically what you need to focus here. Okay, so this is true. Both statements are true. Gene delivery systems, gene therapies use nano. So focus on applications. And range of sectors are getting benefited from nano. Can you name any? Healthcare. How? Healthcare is a main question. Healthcare sector. Cancer treatment we talked about. Diagnostics. Imaging. Better imaging techniques. Nano helps in improving the imaging process. Cancer imaging, body imaging, physiological imaging can happen through nano. So better diagnostics, better imaging, better treatment. Drug delivery systems. Nanobots. Nanobots. Recently they talked about microbots. Micro is bigger. Nano is much tinier. If you are not crossing 100 nanometer scale, they are called nanobots. Agriculture. What are the uses in agriculture? Nano fertilizers. Nano fertilizers. They are slow releasing fertilizers. Nano pesticides. Nano irrigation methods. Nano sensors. Things can sense viruses. Things can sense pollutants. Environmental application plus agricultural application. Textile industries. How are they using in textile industries? Exactly. So particles which are antimicrobial in nature are incorporated into clothes. A very recent application, I think from last year, 21 October, I think, they have created using carbon nanotubes. I think I forgot the university, but American scientists. They have incorporated CNT, carbon nanotube based sensors into clothes, into t-shirts. They have created a t-shirt with built-in nano sensors which acts like an ECG device. Electrocardiogram, either called EKG or ECG, electrocardiogram. They have put electrodes into the wires, thin wires, they look like design on clothes. And it would collect information about the heart functioning, electrical activity of heart is conducted. Through a Bluetooth, this information goes to a neighboring device. So as you are walking, if you are a patient with heart related problem, if there is any abnormality in your heartbeat, that would go to the concerned doctor. So such nanoparticles are being introduced into clothes. So nano is now redefining the way diagnostics are going to work, redefining the way how they are able to monitor abnormalities in our body. Same thing for COVID. They have created nano systems for detecting your symptoms. If there is a increased fever, that will give a signal that you have body temperature being increasing. Or it could be oxygen saturation levels are decreasing. Nano sensors are being created for that during COVID-19 time. So nano is redefining every sector. One sector I would like to mention in addition to this is space technology is one, defense. Have you heard about Baba Kavach? Have you heard about Baba Kavach developed by BARC? Baba Atomic Research Center, BARC has created, this is often in the news, called Baba Kavach. Initially for good reason, later for bad reasons. Initially good reason is they have created a low cost bulletproof jackets. Low cost bulletproof jackets cost only half of the price of jackets in the market. I think it costs about 70,000, 75,000 rupees. In the market, this would cost 1.5 lakh for the same feature. Lightweight bulletproof jackets. They have created lightweight bulletproof jackets. Lightweight bulletproof jackets they have created which can withstand bullets of AK-47 guns, which are called steel bullets. Those stainless steel bullets can be handled by this nano material based, where again they use carbon nanotubes for protecting from those bullets. It is 100 times stronger than steel, but lightweight. It doesn't add too much of weight. Normally we have an impression that strength increases with weight, but opposite is true here. It has less weight but more strength. So we are able to create these type of things, indigenous evolution or indigenous technology that BARC has made. Such applications are coming in the news. New diagnostics for COVID-19. Sterilization. For sterilization, they have created nanomaterial based agents. It's a lot of scope. There are hundreds of examples in the news related to nanotechnology. Okay, brush through this. From the current affairs part, briefly brush through in what areas nanomaterials are being used. Given the size of these applications, I could not pick anything specific, but I wanted to give you a more generalized picture related to that. Nano drug delivery systems, nano diagnostics, and then we are hearing about the even fingerprints. To pick up fingerprints, they have created nano powder. You spray nano powder and fingerprints are more visible. You are increasing the sensitivity of picking of fingerprints now. Okay, so range of applications. Manufacturing, more small scale versions of launchers they are creating in space technology. Okay, right. Going to this specific question from applications. You all know that we have a dedicated mission on nanotechnology in India. Okay, Nano mission. When was it launched? Is it a recent mission or old mission? 2007 mission. So close to at least 14-15 years. Who is heading that mission? We have something called Nano Mission Council. There is a Bharat Ratna awardee who is running that. Very few scientists who received Bharat Ratna. Professor C.N.R. Rao. Professor C.N.R. Rao, who is known as father of nanotechnology in India, he is heading Nano Mission Council. Okay, be familiar about different programs. Recently there was a new version of a program called INUP in the news, INUP. This is Nano Electrons in a users program. This is a training program running under MITI, Ministry of Electronics and Information Technology, or Department of Electronics. Under this, in IISc, IITs, they are creating nano electronic based users program. They are training people to assemble, nano fabricate electronic devices. Okay, they have started a new phase of this in the recent times. So be familiar about such programs in Nano. Then, on top of applications, we are realizing that there are so many problems associated with nanomaterials. How do we address them? First, India started releasing guidelines. In 3 sectors at least since 2019, India has started releasing guidelines. One of them is this. So what are we learning here? Indian government has released guidelines for evaluation of nano pharmaceuticals. It is very specific question. This article came in PIB and majority of the newspapers I have picked up from, which is a very important source for your preparation. So in PIB, I have seen that the guidelines related to nano pharmaceuticals have been released. This is not a very recent development, a development from 2019, but has a very big potential because now we are recognizing issues related to nanomaterials. But is there anything being done in India related to that? So, and I have given a very specific question. This is not a very generic question. Guidelines for evaluation of nanopharmaceuticals to ensure quality without compromising on safety. Quality without compromising on safety, do you see here? And the guidelines will not apply to which of the following. It's a very specific question. Unless you know the information, you cannot answer this. Have you heard about these guidelines being released? Okay, right. So I have given link for the PIB document if you are interested in reading, but I provided just enough data on this. So see if you can guess. With logic, with some understanding, you can guess this question. Finished formulations. It is applicable to finished formulations, meaning already drugs are developed. We know what is the composition of drug, but they carry nanomaterials. For those nanomaterial based drugs, do you think these guidelines are applicable or not? Okay, think about it. Next, already approved molecules that are being altered at nanoscale. They are approved, but you remodified them at nanoscale. Is it applicable? Are these guidelines applicable to them? Next, drug products that contain microbes or proteins at nanoscale. So things that microorganisms are nano, proteins are nano. So these drugs carry microbes, carry proteins. Are these guidelines applicable to them? In vivo diagnostics. In vivo means what? In vivo refers to injecting. In vivo means inside the body, inside the cell, inside the body. So what do we do? Like imaging techniques. We inject some dyes into the body and we take scan of it. So these are called in vivo diagnostics. So in case if you use nanoparticles for in vivo diagnostics, are these rules applicable? Any guesses? So the question here is, these guidelines will not apply. You have to find one of them where it is not applicable. B. A, did you say A? Some of you said A. Guessing A, no negative marking, okay? Feel free to answer. It's D, in vivo diagnostics. So what type of thinking is needed for this? So we are addressing the issue of nanoparticles. Because when nanoparticles enter into the body, they can cause some negative consequences. Drug delivery systems are there. They go into the body, they may damage different tissues, they may become toxic, they may damage DNA, they may accumulate in lungs, kidney, heart, brain. Studies from animals are showing that they become toxic to us. So now, government is addressing this issue by telling you have to follow these rules when you are creating so and so medicines, so and so diagnostics. So which of these area is potential to cause problem? There is one clear point where there is no potential problem to us. Finished formulations can cause problem if they are using nanomaterials. Already existing materials, you modified at nanoscale, you are introducing nanoparticles which can cause problem. So they have to follow these rules. Even you are introducing nanoparticles into the body in vivo diagnostics, can they cause problem? Definitely can cause problem. So they also should accept this. The only thing is C, where microorganisms are natural, proteins are natural. They are not going to cause any new problems to you at nanoscale. They happen to be at nanoscale by nature. So they don't have to follow this because they are naturally there. This is a logic you need. And it's a bit complicated, but even without knowing the answer, knowing that this is naturally existing as nanoparticles should not follow these rules. If you are a pharmaceutical company creating microorganism based drugs, protein based drugs, you don't have to follow these guidelines because they naturally exist, don't cause harm, they are covered by other type of guidelines. Okay, I have given explanation to this, taken from this particular PIB article. Government released them in October 2019. These guidelines are applicable to nanopharmaceuticals in the form of finished formulations, nanopharmaceuticals as active pharmaceutical ingredients. We frequently hear about this as APIs, active pharmaceutical ingredients of a new molecule or already approved molecules. Despite of that, if you made changes, you have to follow these rules. Okay, and those that are altered with nanoscale dimensions, meaning at nano range, they are being altered, and the properties or phenomena associated with nanotechnology for treatment, they have to use it, and they said clearly in vivo diagnostics. In vivo diagnostics, if they are used for, you need to modify them. Mitigation, cure or prevention of diseases and disorders. For any of these purposes, they have to follow guidelines. Okay, the guidelines although do not apply to the conventional drugs. Conventional drug which incidentally carry nanoparticles or drug products containing microbes or proteins. It clearly states that if they incidentally use microorganisms like probiotics foods, they don't need nanotechnology guidelines. Okay, or proteins. We have protein therapeutics like what is that called? Antifibrin material for heart diseases they use. So those type of things do not follow, and no need to follow nanopharmaceutical guidelines because they naturally exist as nanoparticle. If you have created them in the laboratory, then you have to follow them. Either already approved or getting approved after changes at later point of time. All of them have to follow nanotechnology guidelines. Clear? Okay.
So previously, so you talk about the power coverage. What's the negative impact of
What is it?
Disadvantage.
Baba Kavach disadvantage. Recently, it is not a real disadvantage from the making of it, but the way we are making it. They talk about, because it's not consumable, right? So it is externally wall. So there shouldn't be much problem with respect to it. Except for carbon nanotubes which pose threat to the atmosphere, they become new form of pollutants. That is one disadvantage. Second, I think during the large scale, assembly of this, they have compromised on the material. Recently in the news, there was a debate because although this is being created with high quality material, in real application, because ODFs etc. when they were existing, they got a bulk order for creating these things, and they compromised on the material being used. So because of that, what happened? Now, although we have a technology for developing it, because of implementation issues, military is going to get low quality jackets, bulletproof jackets. So practically this seems to be a problem in India. Otherwise, this is a new form of pollutant. When we drop or discard these type of bulletproof jackets, they are adding carbon nanotubes in nature, which have high penetration power. They can impact biodiversity, they can impact plants growth, they can impact animals. That could be seen as a negative problem here, or drawback here.